I am Darian McCormick. I work in the Child Safety and Family Preservation Unit here at the Department of Human Services. I am joined today with several other folks that will be presenting alongside of me, and they will just introduce themselves as we go along. There was an email sent out. There were two emails sent out. One was sent either last week or yesterday, depending on when you registered, that included a Family First Prevention Services frequently asked questions, and then a Prevention Services one-page handout as like a quick reference. If you did not receive that email, please email me after the meeting and I can forward that information to you. This morning, if you were registered this morning by 7:30, you would have received the agenda for today and the PowerPoint slides. Again, if you did not receive those, email me after and I can forward that email to you. We are going to go ahead and get started. I did say in the email that was sent out that today's presentation is focused specifically on the prevention services side of FFPSA. And so there have been a lot of changes and a lot of questions around residential services that went into effect in 2021. And we are not focusing on the residential services, the specialized settings, or QRTPs in today's presentation. This is specific to prevention services. So without further ado, I'm going to turn it over to the outcomes of today's training to develop a better understanding of prevention services under the under FFPSA, understand what Minnesota's Title IV-E prevention plan is, what it means to be an eligible candidate for prevention services, and then also what are those services that are currently included in Minnesota's 5-year plan, and then what is going to be happening for implementation of prevention services. Okay, I will turn it over to you, Rebecca Wilcox.
All right, good morning, everyone. My name is Rebecca Wilcox. I'm the manager of Child Safety and Prevention section here at the Department of Human Services. And thanks for joining us today to talk about prevention services side of the Family First Prevention Services Act, which passed, as many of you know, in 2018. It's a federal law that changes the way that child welfare services are provided, designed to prevent removal of children by helping parents and families connect to essential services to help them maintain safety and stability. FFPSA allows states to access Title IV-E funding for these prevention services to prevent the removal of children by connecting families with these services. The prevention services part of FFPSA allows county, state, and tribal child welfare agencies the ability to receive reimbursement for certain evidence-based services for children at imminent removal of out-of-home placement. The one exception is for parenting and pregnant youth that are in foster care. That's the only carve out. Otherwise, this is for children that are in their home with their families or kin. These evidence-based service categories include in-home parenting, mental health, and substance abuse, and must be evidence-based, like I mentioned, and approved by the Federal Clearinghouse. We will get into much more detail today about the ins and outs of the prevention services side of things. Next slide. So we'll discuss each one of these components today, including eligibility, services, and evidence criteria. The goal really is to support at-risk families with services that allow children to remain safe with their families, or even when they are removed upon return to their families. While prevention services part of FFPSA is an optional part of the federal law, states can opt in to this 4E component. We did indeed, that's why we're here, opt into this part of FFPSA. And with that, we were required to submit a Title IV-E 5-year prevention services plan. Our plan was submitted in September of 2022, so just last fall, and was approved this January. Next slide. The prevention services under FFPSA is only one part of the work when we consider the continuum of prevention services in Minnesota. So it's that kind of that last dark green bucket on the far right. This continuum diagram maps out the range of how we think about prevention across the continuum. Prevention services generally is that in placement prevention strategy. However, prevention services should be part of a comprehensive cross-system continuum, which is demonstrated by this particular diagram. There are multiple strategies related to prevention, and prevention services is just one of those strategies. Next slide. We have several values when it comes to implementation of FFPSA. In our work so far, we've arrived at these common values. Children belong with their families, and the child welfare system has an obligation to support and partner with families, communities, organizations, and systems. We'll use a family-focused or family-first approach. We're going to center equity in practice, ensure coordination, collaboration, innovation, and family preservation, service and delivery. Ensure that the child welfare workforce is prepared, that you're supported for successful implementation of family preservation services, and to support a family-centered approach and strengthening our approaches to keep kids safe and home with their families whenever possible. Next slide. Our goals related to prevention services includes improving the health and well-being of families, reducing maltreatment, and keeping kids with their families. You can see a theme here, reducing initial entry and reentry into foster care, responding to and eliminating disproportionality, so address and eliminate disproportionality in our system, and strengthening our workforce. Expand our service array in a culturally responsive way and a coordinated way. And to really think about our system as a coordinated one that works on family preservation and strengthens families to improve outcomes for kids and families. Next slide. We do have a larger vision of prevention that lands within and outside of the scope of prevention services under FFPSA and beyond. This includes building and creating a strong initial foundation of prevention services tied to transformation. Continued expansion of services informed by collaborators and families. Using our continuous quality improvement strategies to continue to strengthen our programs and our workforce. And coordinate outside of prevention services, outside of Family First, to build a robust continuum for families wherever they are, wherever they land, whether it's within the child welfare system or outside, preferably outside, but we're working across that continuum. All right, next slide. So FFPSA, as mentioned previously, we submitted our plan last September. States were required to include a number of elements within the plan that we submitted. Prevention services candidacy as defined by the state. So we had to define candidacy, select services that we have submitted for reimbursement, identify our continuous quality improvement strategy, and define our workforce support and training strategies. Next slide. Our plan was developed under this structure, and it was a multi-year process, including a few iterations of this particular structure. This diagram is the final structure that the plan was developed under, and we have continued to work towards implementation, and we'll continue or later discuss the current implementation structure later on in the webinar. Our candidacy requirements, there were several requirements tied to FFPSA, which both create opportunities and challenges to implementation. These requirements include safety and risk must be monitored continuously. A child-specific prevention plan must be created for each candidate. Children may be served for up to 12 months before eligibility needs to be reestablished. And finally, multiple child-specific data reporting requirements are included, including tracking post-service delivery, so even after the case is closed. There's some reporting elements that will be required at the state level to report. So within this, right, there's opportunities to prevent children at imminent risk. Previous slide still. Prevent children at imminent risk of entering foster care, provide financing for specific services, development of additional services can contribute to a larger prevention continuum that I spoke about earlier, and creates a practice shift to increase focus on child safety within their own homes. Of course, there are challenges, which include the requirement that families to be on a plan that's overseen by the Title IV or the Child Welfare Agency. The concern of over surveillance of families that can lead to deeper end involvement, and limited services, lack of culturally relevant services, and the federal requirement related to evidence-based rather than evidence-informed. And so those are all federal requirements. Next slide. So this slide is our current eligibility and candidacy definition. This was created under the Plan Development Work Group structure that I spoke to earlier. Data was analyzed to determine the children in Minnesota to be at highest risk of entering out-of-home care. Language that's which is language that's part of the federal law. The data led the work group to the following definition of candidacy. A candidacy for prevention services must be the alleged victim in a screened-in child protection report, have an open child protection case management work group, and meet at least one of the following requirements. So previously in out-of-home care, identified need for child protective services, the alleged victim in a previous child maltreatment report, an allegation involving caregiver substance abuse, a child behavioral or mental health concerns. And again, there's that orange shape that is the exception. So all the kids in blue have to be in their homes. The kids that are parenting or expecting, and in foster care can also be considered candidates. In addition to candidates, the plan development work group selected MI, motivational interviewing, and PAT, or parents as teachers, as Minnesota's first two prevention services. And we'll discuss both of those services later on in the webinar. So where are we? Next slide, yep, is the implementation. We're currently in that bucket where we may have to move our circle over now that it's June already. But we've submitted and approved our plan. Apologies, brief distraction there. We're currently in the implementation phase of prevention services, and this timeline depicts the process where we're in and submission, past plan submission and approval into implementation planning, and you can see that we'll be moving into future services exploration, our CQI, or continuous quality improvement, fidelity monitoring, and ongoing implementation over the coming year or so here depicted. Next slide, please. So while we've been making the shift for some time, prevention services is an important marker in child welfare law and practice. It does expand a program that historically only allowed reimbursement for foster care adoptions and to move it to further upstream. Further prevention services goes beyond an opportunity in funding. It creates the opportunity for practice and system transformation. Prevention services allows us to put our values into action to strengthen families and prevent out-of-home care using foster care as the absolute last resort. Next slide. This practice transformation further emphasizes the importance of family preservation, centering the family in decision-making, collaboration with other family members, kin, support people, and system providers, and sets a high standard for removal and out-of-home care. This practice transformation starts with you and your work every day. Next slide. While the department will be providing training specific to FFPSA prevention services, including motivational interviewing training, which you'll hear about later, Additional efforts to support and equip the workforce are underway, and the workforce is you. The department, together with others, have been developing a child safety framework, including safety practice profiles, to help strengthen safety assessment and planning across the continuum. The safety practice profiles have undergone 2 pilot phases, and efforts to finalize fidelity monitoring plans are underway. More information will be provided in the coming months about the safety framework, safety practice profiles, and how it all fits together with prevention services and practice transformation. And with that, my section is concluded. I will turn it over to Megan Sunny for the next section.
Hello, everybody. Good morning. I am Megan Senni. I will be discussing the individual services on the prevention plan, how they were selected, and what we currently know how implementation will look like. I work for DHS and have been working with many others on the development and now the implementation of the prevention plan, and specifically around the prevention services that are on the prevention plan. I'm going to share an overview of what's required under Family First and what's required for each individual services, and then discuss the selected services on the prevention plan. So each specific service on the prevention plan or services under Family First must be trauma informed. They must be evidence-based and have an approved rating by the Title 4E Prevention Services Clearinghouse. The Clearinghouse was created to review programs to determine if they're eligible under Family First. It's similar to the California Clearinghouse, if you are familiar with that. The 3 service categories that are eligible under Family First are mental health, substance abuse, or in-home parent skill-based programs. The services must target outcomes related to child welfare or show positive outcomes in the areas of safety, permanency, child well-being, and adult well-being. And then lastly, the services must be on the state's 4E 5-year prevention plan. Okay, the next slide. And this slide, I won't go too much into detail, but just wanted to touch more on the evidence standards that are used to review and approve programs under Family First. So each program that is reviewed by the clearinghouse receives one of the ratings that you see in each of the colored boxes. So the programs either receive a does not currently meet criteria rating, which would mean they were not eligible under Family First, or they may receive a promising supported practice or well-supported practice rating, which would mean that they are approved under Family First. Anyone may submit a program to the clearinghouse to be reviewed under Family First. And the process is services are submitted for review to the clearinghouse. They must be replicable and have a replicable service, meaning they must have like a manual or written protocol showing how to implement and administrate the practice. They must be in use and active. Then the clearinghouse then reviews evidence research and looks at other clearinghouses to determine the evidence rating. One thing I wanted to note here is that this entire process does create some barriers for some programs that are more culturally relevant or culturally specific, because it does use a high evidentiary standards that requires time and resources to complete the individual studies that are reviewed by the clearinghouse, and leaves out many culturally relevant practices or tailored practices that are in practice. So it does create barriers there. as we look, oh, sorry, you can go to the next slide. So I am now going to talk about how Minnesota selected its initial services. There was a work group process to select the services that are currently on Minnesota's prevention plan. In that work group, included internal staff and external staff from counties, tribal agencies, and community agencies. An individual lived experience to look at what services are currently being used in Minnesota, which ones may be eligible under Family First, and which ones met the needs of the potential eligible population. We also reviewed the, from a cultural lens, looking at services that were found to be effective with diverse populations, mainly African American, Black, or American Indian, Alaska Native populations, which experience higher disproportionalities in Minnesota, and use that general criteria to select services on Minnesota's plan. Also want to reiterate that these selected services are the initial services. States may resubmit their prevention plans at any time, such as to add additional services. And we do plan on adding additional services in the future, but these are the services that are currently on Minnesota's prevention plan. Okay, and we're just sharing this slide again to show what the eligible child population is before we discuss the prevention services. Again, children will be eligible if they are not in foster care, are an alleged victim in a screened-in child maltreatment report, and have an open child protection case management work group and meet one of the following that are in the blue octagons. And their caregivers are eligible also to receive prevention services. The only population that is eligible, that is currently in foster care, is a child who is pregnant or parenting youth in foster care and their child, and this includes both parents. So now we'll go over the two services that are on Minnesota's prevention plan, what they are, why they were chosen, and the plan for implementation, and where we're at in implementation. The two selected services on Minnesota's plan are motivational interviewing and parents as teachers. These services were chosen because they are already being provided or implemented in Minnesota. They are found to be effective with diverse populations based on national data and work group feedback through the work group process. There's some flexibility in the programs, potential for expansion through Family First. They met the needs of the most at-risk populations. The first program is motivational interviewing. And motivational interviewing, it's an engagement method that promotes behavior change and increases motivation when there's an ambivalence to change. The goal with it being included in the prevention plan is for it to be implemented statewide. Motivational interviewing will be used by caseworkers to engage families in services and safety planning. The target population of the service will be caregivers of children. Workers will go through training and certification process through the Child Welfare Training Academy, who's partnering with the Center for Practice Transformation. And in the future, the Tribal Training Certification Program will also offer training. Renee Armstrong from the Training Academy will speak more to what that process will look like next. The second service is Parents as Teachers. Parents as Teachers is an in-home visiting program. Again, it's currently being implemented in Minnesota. It uses visits, group connections, resource networks, and evidence-based screening to support families and improve positive parenting practices. Children are eligible ages prenatal up until entry into kindergarten. Eligibility of the program is relatively flexible, and a child may enroll at any age within that time frame. Parents as Teachers is one of the many evidence-based programs that are already implemented in Minnesota. The Parents as Teachers, the plan for implementation is that it will be implemented with current Parents as Teachers affiliates, which currently do not include child welfare agencies. There are 13 Parents as Teachers affiliate sites in Minnesota, and those are mostly public health or nonprofit agencies. So child welfare agency staff will not be providing Parents as Teachers initially. It is also not available statewide, which is also one of the reasons why it was chosen as a service for the potential for expansion, but it is mostly available in the metro area. And on the slide is a list of the current Parents as Teachers affiliate sites in Minnesota. Okay, so here we just want to emphasize that, again, motivational interviewing is the only service that will be provided by caseworkers or child welfare workforce staff, and that it will be used for caseworkers to engage children, parents, or caregivers in services and safety planning. We chose this service because of the evidence and how it can be used in practice and engagement with families. This is something we saw a value in implementing, and Renee is going to speak more to motivational interviewing and what that training and certification process will look like. So I will hand it over.
Megan. As mentioned, my name is Renee Armstrong. I'm the Supervisor of Training Operations and Policy at the Minnesota Child Welfare Training Academy. And we've had the pleasure of partnering with the Center for Practice Transformation, who's developing and has the expertise around motivational interviewing, and particularly around the curriculum and initial delivery. And so I'll be speaking this morning a little bit about the initial components of that training itself and what will be taking place. And also about a little bit of sharing a little bit of what kind of work and collaboration that has taken to build that. Our partners have done a lot of extensive research and analysis across the country with other states who, of course, are implementing this work, particularly within child welfare, to ensure that it is of high caliber, and also really connecting and collaborating with our training, our tribal training partnerships, certification partnerships, as well as really looking at from the field, what does it mean to serve child welfare to the child welfare field in Minnesota, like different than other states. So keeping all of those things in mind, really looking at what will it take then to have a certification that meets these evidence-based practice with high fidelity, while also taking into account some of the unique and specific needs of Minnesota child welfare practice. So that's a little bit of the context we'll speak to. In terms of the components of our Minnesota training certification, keeping in mind that this is serving truly as a minimum qualification or certification for the experience of motivational interviewing. We want to recognize that there's extensive training anyone can continue to take. So we say that because we hope that as a worker takes this training, there is continued growth and skill development over time, because that is what motivational interviewing's philosophy is around, and particularly around really adapting one's practice to any behavior change and skill development, is continue to build those skills to ensure that your practice is continuing to meet the needs of families in the best way possible. So to speak around truly what our components include, at a high level, you see on the screen the bullets that will make up the certification. I'm going to go into a little more detail about those. And first off, they include an initial introduction to motivational interviewing self-paced module that focuses, it's asynchronous. So what we kind of consider as like an on-demand self-paced module that addresses the foundational principles of motivational interviewing, its relevance to child protection, and will provide an overview of the training and certification process and requirements. Following that, there'll be a live virtual workshops, and after completing the introduction, folks will be able to be eligible to participate in this live virtual workshop that focuses on developing motivational interviewing skills that are identified as particularly relevant and useful for CPS workers and their clients and families and folks you'll be working with. And so those take up truly an opportunity to then kind of, again, live virtual, so opportunity to be able to be in space with folks virtually. And those are chunked out into around 3.5-hour segments that are spaced 1 week apart over the course of 4 weeks to allow for in-session or throughout that experience practice between weeks. And the workshop segments are focused on, again, skill development and practice. Following that are coaching circles, and coaching circles are a fundamental part of effective MI training, and to be certified, participants will need to attend a minimum of 4 distinct coaching circles within 6 months of completing the workshops. So there's lots of a great latitude for fitting in those workshops. So one could essentially take them immediately after those virtual workshops, 1 week apart or within, to ensure that you continue to build those skills, or depending on how your schedule allows, you could space that out. Folks are welcome to attend more if their schedule allows. So again, 4 are required, and they'll be offered regularly to make sure that folks can plug in, and they'll be focused on some different skills of motivational interviewing to ensure that you can refine your skills and kind of connect with others in the field to practice and develop your skills to prepare, not just for the initial assessment, of course, but to also prepare for your practice with families. The coaching circles are 50 minutes, and they focus, as mentioned, on skill development and practice, and are facilitated by Mint certified workshop trainers. 4 to 8 coaching circles will be offered at a regularly scheduled times each month. As more trainers are qualified and more trainees are needed, trainees are needing the coaching circles, more will be scheduled. And let's see. Oh, the big piece of that too, again, that's there'll be enrollment will really be based on a limited participants to allow for small groups and individual practice for demonstration and feedback sessions to really support everyone's individual development and growth. So that's a really great opportunity that really supports folks as you are building those skills to really practice those skills and be able to get feedback along the way. Following those learning and workshop and skill development opportunities is the initial assessment. And this is the evaluation of a participant's or workers' motivational interviewing skills and strategies that ensures a baseline competency. Again, this is our as a state, our minimum qualification, we would say our minimum assessment to allow and certify folks in the child welfare motivational interviewing. This is really going to be, again, a baseline to really capture, and again, continued training and support and continued skill development is going to be ultimately your goal, just to continue those skills. But their minimum, a minimum baseline assessment is what will be taken after these previous activities. And if someone, for example, doesn't meet that initial baseline, folks are welcome to then take it again, go back and attend some coaching circles to check in and practice a little bit more and make sure that they can refine and increase their abilities, and then retake the assessment and have that attempt to be met. Folks can work, of course, with others in the field and along with the trainers to support your growth as well. This isn't something we see as something that it should be a mystery or anything like that. The coaching circles truly are opportunities to be able to practice exactly what one might practice in the initial assessment, to be able to show of snapshot of the skills that have been developed. And so what is being developed are opportunities to just simply plug into exercises and opportunities to practice those skills that will be assessed in a minimum baseline to ensure that those practices of motivational interviewing can be met with fidelity across the state. The pilot delivery phase will begin this August for the initial 6 months of delivery, and we have some prerequisites that are part of this training. As any specialized course, and this will be serve as a specialized course at the Academy's implementation, a worker is required to have completed new worker training, or what we call foundations right now. Part of this foundations training does include the ICWA MIFPA course that's offered by TTCP. If you have completed new worker training in the last 3.5 years, you've met this requirement, and you can simply be prepared to register upon those dates being open for registration. So keep that in mind. Again, now I'm just going to say that again, because for the last 3.5 years, the ICWA MIFPA training has been part of our initial new worker foundations training. So if you've taken new worker training in the last 3.5 years, you've met this initial prerequisite. If you are a worker that's been in the field for more than 3.5 years, you do have a prerequisite then to take the ICWA MIFPA training prior than the MI training. And again, our partners at TTCP have many training offerings scheduled. They have virtual options and in person at different locations across the state. So we'll be partnering with them on messaging and making sure that outreach gets out around those offerings. So if that's something that you need to take, you know where to go and make sure that you can get that going too. And particularly be partnering with your team and your supervisor around the process for that. So something to keep in mind, for example, is that part of taking the completing as a team and thinking about making sure that your agency is going through motivational interviewing in the way that you plan to or can be reimbursed for, is partnering and really teaming with your supervisor and your team to ensure and decide who's going to take it, and that if you are going to be taking it, that your supervisor also is in the know, as they also need to be taking it before, during, or after you take it within 6 months of starting the MI training. So that's a key piece to keep in mind. This is again a very important part of implementation, is that you as workers are supported in this skill development, and so we want to ensure that that is built and sustained in the process. And so at the very least, your supervisors are required to again take the training the same time before or after within 6 months of your workers training it as well. Let's see, what did I miss? We do have some details out. If you are part of an agency that has already taken some training in motivational interviewing, that is something that's part of what we're calling kind of a grandparenting in process. So in the last 2 years, if you are part of a team or an agency that has taken some motivational interviewing training from a MINT certified trainer, and that's training that you can show that you have evidence of sharing, we would be asking for proof of that completed training within the last 2 years, and then you'd be able to take that initial assessment for proof of that skill development. Of course, we'd also just want to make sure you check in on if you'd have the prerequisite of the ICWA MIFPA training or not completed. Again, that is if somebody has taken new worker training in the last 3.5 years, this prerequisite has been met. If you're a worker in the field longer, 3.5 years, that would continue to be a prerequisite that would be needing to complete. So there's opportunities. Again, we know that there's folks across the state who've been part of some motivational interviewing training and investment in your agency over the years. And we are excited to make sure that that's something that can be part of recognized and part of this process as well. What we want to make sure we are mindful of is ensuring that there is some consistency in the certification process and really make sure that folks have similar skills across the state to support families. So keeping those things in mind, we want to make sure that as workers, you know that no matter if your agency has had previous training or not, everyone is welcome to coaching circles. Coaching circles are for you as workers to practice, enhance your skills and skill development and motivational interviewing. And that's an option that anybody can plug into. So that is something to keep in mind. Something that's also quite flexible for workers and across agencies is that staff can take these components and complete them within 2.5 or 3 months, or take as long as 6 months to complete them, depending upon how long they're taken and spaced out across time. We do ask workers to complete within 6 months to ensure that skills are built on and that skills and knowledge are retained, right? So that you can be building on them and then taking the assessment within an amount of time where you're still having content and skills fresh. So that is a big piece of this implementation, is that there is flexibility to take and plug into these training components as it meets your schedule. We know that you all have a lot on your plate as you are supporting families and case work. So be mindful of that. A big takeaway we want to emphasize is also, as mentioned, to be in discussion and collaboration with your supervisor as you plan your registration for motivational interviewing training. So that's a really big component, is making sure that, again, determining who takes the training, if it's you on your team or others or a number of you, and also that you're talking and working with your supervisor as they also will need to go through the training within a time frame around your attending as well. What you see on the screen now are simply just a little bit of the trajectory of this timeline. So coming a little bit higher level, as you'll see that big picture, a lot of this has been discussed in the last hour, is that, again, our evidence-based practice identification happened quite a long time ago, really determining what makes sense to offer here in Minnesota, and really working within our collaborations and partnerships to determine how best we implement motivational interviewing in Minnesota with the needs of families we have, with the agencies and tribal nations we partner with the disparities and disproportionalities across the state that are present. We want to be very intentional around making sure we're building in transformative practice in the state and partnering with you all along the way. So we're really excited. We're really excited about making sure that you all are supported and invested in this work. And that's a really exciting piece about FFPSA implementation. So we'll be moving into our phase, kind of our first phase of pilot delivery, as mentioned, in August, to continue to implement motivational interviewing and offering the initial cohorts. We know that it will take quite some time to train folks, and that again, going back to your supervisor and your team to determine at what point and at what timeline it makes sense that you or your team take motivation, get trained in motivational interviewing based on the readiness of your agency and the any prerequisites that are needed from you or others on your team. So that's a big piece of that, and we're again excited to support folks and agencies along the way. So I'll pause now for questions, and particularly see if there's any in the chat.
Yeah, Renee, we have one. Are there other staff, for example, a manager or lead, that can meet the requirements for a supervisor attending?
Oh, great question. Some of that has been discussed. I think what we'll be working on a little bit is determining if if outside of supervisors will meet that at this time. And I guess maybe I'll defer a little bit to Megan and Darianne as well, if there's more definition around that. I think my understanding is that supervisors are, is what we're using for that connection. Again, I understand that depending on the agency, there are lead workers or other peer mentors that could probably really support some of this sustainability.
I'll say that was part of the recommendations to also have that include a champion of MI, which could look like a manager or a lead, but that hasn't been defined yet.
I think one of the things that has to be considered is that for the fidelity of MI and that ongoing supervision and coaching of the staff. And so that might happen in a lead worker role. But I think that that's something to continue discussions within the work group, because I do think for the fidelity and the model of MI is really to have that the supervision and coaching as part of the practice.
Correct.
There were a couple of, oh, go ahead, Renee.
Well, all I was going to speak to was that I think right now, and it's correct in the initial delivery implementation, that's what we have defined around. So we would be in touch if there be any change of or update to that. And were there other
a couple of
questions?
other questions in the chat. I just want to go back to the very beginning to make sure everybody saw the answer, but there was a question about do FFPSA prevention services apply to children's mental health? The prevention services side of FFPSA is different. There's different qualifications or requirements than the residential services side of FFPSA. And so for residential side, yes, it applies to children's mental health, child welfare in those cases. Currently for the FFPSA prevention services candidacy, that is specific to those that have an open child protection work group and then also meet the other criteria that were explained earlier. And then the one exception is pregnant or parenting youth in foster care. Okay, there are some other questions.
Yeah, I don't know if you can see those, Darianne, and otherwise I can shut them out.
Good questions. So I think, Lacey, your question about prior training, we'll be getting out details around any previous training that can be shown and kind of used. We're really asking for certain evidence of training carried out by a Mint certified trainer within the last 2 years. And so if that pertains to you, that would be something you potentially could show proof of. So we'll be, I think that keeping that in mind, if it's more than 2 years ago, we would be looking for a refresher, proof of a refresher by, again, a Mint certified trainer. We understand that, again, the balance in this is ensuring that there is a level of fidelity for motivational training, particularly around as we look at particularly implementing this within child welfare. And so we want to honor prior training that workers have carried out and that agencies have invested in, and making sure that it is a fresh and updated and connected and tied to one's work. So we'll be in touch on that. Again, if you feel that the details that you see are definitely pertain to you, that would be an opportunity to show the proof of the training you've gotten, again, within 2 years, or a refresher within a year of that, a year.
And Renee, I'm just gonna read that question so everybody knows what it was. So it was, I had 8 years of MI training ongoing in my last job. Is there any way for that to be used? Okay, so go ahead, whatever one you want to answer.
I see a question about the specific ICWMIPA course that needs to be taken. Good question. So I'll try to stick it in the chat. I'm struggling to find it, to grab the exact one right now, but essentially our partners with TTCP we, essentially right now we partner in offering the ICWA MIFPA training that focuses, it's a 2-day training that focuses on the provisions of ICWA along with the spirit of ICWA. And that is training that's taken, it's integrated into our current new worker training requirements for the last 3.5 years. So if you have taken, if you've been in the field longer than 3.5 years, they also offer it as the training they call it is speak to it as the ongoing ICWA MIFPA training. And so it's something one can take outside of new worker foundations requirements. So that would be something to take otherwise. So thanks. I think we have it in here too. So we'll make sure what I wanted to emphasize is that we'll be providing outreach and information around all the the most current updated upcoming dates for those trainings so that everyone can be knowing and staying in the loop on that. At the Academy, we have those ICWA MIFPA courses within our training catalog. And so if folks are looking for those, they can be grabbing those dates right now and plugging into them. Or again, if you've taken new worker training in the last 3.5 years, you have already met this training. So that could likely pertain to you as well.
Yeah, then we have the question, is there a baseline expectation for how many staff are trained? Do all child protection staff need training, or can 1 or 2 be trained?
For that, the goal really is to eventually have all of the Minnesota child welfare workforce trained in motivational interviewing. That is the ultimate end goal, and we know that that's going to take a while. We've talked to other states. For example, Michigan, they've been training for 2.5 years now, and they're still working on having all staff trained. So really, this is the practice transformation and that shift of in the work that we're doing with families. So the end goal is for all of child welfare staff to be trained. There is another question too about does only the supervisor need to be MI certified, or do the workers who will be working with the families need to be as well? And yes, it will be the workers that will be certified in MI in addition to the supervisors who will be supporting those staff. I think that is all. Those are all the questions in the chat. We will have time also at the end for questions. And if there's anything that we don't get to, then we can do a follow-up email as well. Right now, we're gonna go ahead and turn things over to Michelle to talk about continuous quality improvement. Go ahead, Michelle.
Hello, everyone. My name is Michelle. I'm a part of the Child Safety and Permanency CQI section, specifically change management, with a specialization in the FFPSA. Today we're just kind of going to go over some requirements, specifications related to CQI and its involvement in FFPSA. So a state's prevention service plan must include descriptions of how implementation of services or programs selected will be continuously monitored to ensure fidelity to the practice model and determines outcomes achieved, and how information learned from monitoring will be used to refine and improve practices. A waiver must be required for evaluation requirements if a selected service has received an evidence rating of well supported by the Title IV Prevention Service Clearinghouse, and the department provides compelling evidence of evidence-based practices, effectiveness, and meets CQI requirements. The department is only selecting evidence-based practice rates as well supported for initial implementation of prevention plan. And it is requesting an evaluation waiver for programs selected for the prevention plan. Compelling evidence for effectiveness of each program is provided in this section. So we'll kind of talk about that in the next slide. So this is just going over the specifications of fidelity, monitoring and evaluation. Minnesota's Child Welfare Continuous Quality Improvement section will provide both quantitative and qualitative data to monitor and understand the impacts of PAT parent as teachers, and MI motivational interviewing has on children and family receiving the services as well as the workforce. Data collected will be, data collected will monitor proximal and distal outcomes as well as the fidelity to each of the models. So, kind of going over, making sure that the services and programs are doing what they're intended to do. Qualitative data is generated through selected data fields and SSIS, both currently available and planned to be integrated, and will be visualized through Tableau. Qualitative data will be collected through case reviews, the processes of that, surveys, mappings. What else do we kind of go over? Focus groups and observations. Qualitative data will be coded and analyzed using Niveau software to identify barriers, facilitators, gaps in practice, practice drift, and other themes with potential impact on identifying outcomes. Barriers, facilitators, gaps, and drifting and other themes will be provided to and feedback received for implementation teams, service providers, participants, and workforce for further analysis to determine what/if any additional learnings are needed, and identify areas of need for improvement to better serve children and families. So we are going to have different realms as it relates to qualitative and quantitative data analysis, just to making sure that when we do provide these services to the community, that they are doing what they're intended to do, and that if not, we are making improvements to make sure that continues to happen. So with that being said, we are still figuring out what fidelity monitoring will look like, and what your role would be in that. So we're definitely going to have a situation where there's collaboration between DHS and workers. So if we can also go over the case specific that just says we must have child specific prevention plan in each case, and this is going to be embedded in the newly redesigned family support plan. And we are focusing on safety and risk being monitored using SDM process. So that's basically kind of what we have going on for the CQI component of FFPSA. Thank you, guys.
Okay, so now I am going to talk about what do we do next? What do you as a staff or child welfare worker, what do you have to focus on and what do we do next? I introduced myself at the beginning, but for those of you that joined late, I'm Darian McCormick, and I work in the Child Safety and Family Preservation Unit, currently working on Family First Prevention Services implementation. Okay, so this first half of the first hour of our webinar today, we talked about all of these changes that are coming, but we're not quite there yet. This is one of, the first, well, this is the second of presentations that we are having specifically for prevention services, the prevention services side of FFPSA. So we will continue to provide information and trainings as more is developed. For example, one of the things that we're working on right now is determining eligibility for prevention services within SSIS. And so there will be a separate, like a brief training that staff will have to do to know what to do to determine whether or not a child is eligible. I will say that a lot of like what we're trying to do with some of the changes in SSIS, we're trying to make it as simple as possible because we acknowledge that this is a lot and that there's a lot on the plates of child protection staff, and this can seem overwhelming, and we acknowledge that. And so we are trying to make it as streamlined as possible. The other thing to look out for is, when can you talk to your supervisor about when you can take the motivational interviewing training. As Renee mentioned, check your prerequisites. for that ICWA MIFPA training. And if that's something that you have to do before you can become certified in MI, then, you know, sign up for that. And we can, when we send out, I've compiled some of the questions that came through the first webinar that was for supervisors and managers and directors. And then we'll compile some of our questions from today's webinar, and we'll be sending a follow-up email with information, and I can include that ICWA MIFPA training information too. Renee, if you want to get that to me, we can put that in the email. And then, you know, eventually all of this information and all the changes are eventually going to be implemented into new worker training or foundations training for staff and supervisors. So it will be, you know, this is just going to be part of child welfare practice in Minnesota. There's you might see a shift in language, moving away from, you know, child protection caseworkers and really focusing on family preservation workers. They might be called field staff or child protection caseworkers. There's lots of different names that we use here in Minnesota, and that we really want to focus on family engagement and family preservation. Also, as part of the Title 4E FFPSA Prevention Services Plan here in Minnesota, there was a recommendation for, you know, 12 cases per worker that is providing family preservation services. We know that that's a goal. That's you know, what we really want to strive for. We also acknowledge there's, you know, currently a lot of staff turnover, and that 12 cases might seem low, but that is something that we're going to be striving for. Throughout the time of our work groups focusing on FFPSA family or FFPSA prevention services, the big theme that was highlighted was improving family engagement, improving workers' ability to engage with families. And that really is one of the things that we're trying to do here with training staff in motivational interviewing, and having that as a tool and as a resource for staff and their supervisors to improve that family engagement, and really to focus on family-centered services and client-centered services. So all of the links that you'll see in the PowerPoint that was also emailed out, you can click on those links and that will bring you to the resource. So I highlighted a couple of resources here regarding motivational interviewing for child welfare professionals. And so if you want to read up more, feel free to access those resources through the slides. And so when we think about changes within SSIS, there will be some changes that come along with prevention services. The department has been, one of those changes is around claiming. So the department has been working with on multiple elements to ensure that we can submit claims on behalf of counties and initiative tribes for that Title 4E reimbursement that comes with prevention services. So the Title 4E, it includes Title 4E administrative claiming, services claiming, and training related to prevention services. The specifics of how to claim and submit all of that to the department will be laid out in coming months. So again, we're laying the foundation for prevention services, and we will continue to provide information as we know more. We are working diligently to minimize the changes to SSIS, but there will be some that are required for reporting and to make sure it's as accurate as possible for the reporting on the Title 4E funding. The specifics of how to claim and submit will be laid out further in the coming months. So in order for reimbursement to happen, there's several things that have to be in place. There has to be a federally approved Title IV-E prevention services plan. As Rebecca mentioned earlier, that was approved in January for Minnesota, January of 2023. Only services approved in the plan are eligible for reimbursement under Title IV-E prevention services. So that MI, the motivational interviewing, and then the parents as teachers. And those are going to be set up two separate ways because MI is something currently that we are projecting the child welfare workforce to provide, and the PAT would be provided by a community agency or public health office. There has to be a completed case plan in SSIS. You will see some, I didn't mention that. You will see some changes to the child protection case plans, in addition, and also the child welfare case plans. The plan was updated through the work group process and will be released sometime later this year. There will be announcements and information provided on those changes as well. And part of the case plan redesign was to meet the requirements of FFPSA to include child-specific services. There will be, or there have to be Title IV-E reporting and claiming process in place. I explained that earlier, and then an approval of the cost allocation plan. There are other funding streams, other federal funding streams, such as child welfare targeted case management and children's mental health targeted case management. Those are other federal funding sources and cannot be claimed at the same time for the same child with FFPSA prevention services. And the same for traditional Title IV-E foster care candidate. Claiming should be made on a case-by-case basis. And again, more information around claiming will be released in the coming months. So what can you do for your next steps as a child welfare professional? The department, what we'll continue to do is provide meaningful information as it relates to prevention services. In the meantime, once the MI training is available, it's important for staff who will be providing family preservation services or prevention services. It's important for those staff to be trained in MI. So this is a big first step, not just for claiming purposes, but also to achieve the vision and the goals that have been set out in Minnesota's 4E prevention services plan. If you haven't taken the required MIFBA ICWA training, that would be one of your next first steps. Are there any? Okay. Okay, I also included a list of resources that you can access here. Again, this was in the PowerPoint sent out, and you can click on each of these links and it will bring you to the resources. One of the things for your next steps, if you are not already signed up for the Family First news and updates, if you're not on that listserv, that's this one, oh shoot, sorry, the third one down. Some people were having problems clicking on it. Depends on the browser that you're using. I think you have to maybe use the Google Chrome, but sign up for announcements there. That's where we do release a lot of our information of changes happening or when things are going to, updates along the way. If you haven't had a chance to take a look at the frequently asked questions document that I sent out last week and then again yesterday for those who registered later, take a look at that. And then we didn't talk about Family First we didn't talk about kinship navigator services in this webinar, but there is also a frequently asked questions document on that, which is linked here in the resources. I am going to pause here. We have about 12 minutes left. Sorry if I kind of went through that fast. I wanted to make sure that we had a chance to cover any questions. You can feel free to put questions in the chat, or if you want to, raise your hand and unmute yourself, you can do that too. I know this was a lot of information, and it might be a lot of new information for many of you if you haven't been involved in other conversations around Family First Prevention Services. And I don't know, Marissa, I know you're monitoring the chat, if there's anything there that hasn't been answered yet right now.
No, I think you touched on this. We had questions about if there's a time frame for the ICWA MIFA training, and we will have the specific time frames confirmed soon. We're in the process of checking on the contents across to make sure it's the continuity's there with the current ICWA MIFA training. But we should have that information confirmed soon. But as of right now, we don't have any specific time frame. Other than that, we don't have any new questions, so people can put those in, as you said, or raise their hand.
Questions? All right. I'm going to give it one more minute, and then if there are no other questions, and if anyone else from the team has anything that they want to say or clarify, feel free to speak up now. Otherwise, I think that is all for our training. Thank you, everybody, for being here today. I appreciate you spending your time with us this morning, and make sure to subscribe to the newsletters, and you will get more information as more information is released. This also will be shared, this webinar will be shared to the Training Academy's website, and will be accessible to folks on your teams if they weren't able to be here today.